And the roots of this is this little chart. And this is just an example, and you'll read more and more about this in papers that are coming out. But we've been doing this for about 20 years. And what we do is we look at a disease and say, well, it affects wildlife. Brucellosis is a great example. It affects domestic animals, of course, that's where it came from. People can get it. In Mongolia, about 80% of the livestock is infected with brucellosis, and people are getting sick from it all the time. It's easily prevented with about a 35-cent vaccine. You can prevent people from getting it. And with about $1.50's worth of tetracycline, you can treat people. So it's very simple problems, and they're very widespread because no one's looked at it holistically before. And it affects human livelihood, so people are suffering. They're stuck in poverty. They don't have food because these diseases affect their food resources. It makes them go out and hunt more. It makes them go poach more. It makes them use other natural resources poorly because they don't have food security. So it's really all tied together, and you can go through disease after disease. How do we use it as a conservation group is it brings people to the conservation table that weren't interested before. Bolivia is a great example. Now the Public Health Ministry wants to work with us because we're out in these remote areas dealing with people. The Ministry of Agriculture wants to work with us because we're out in these remote areas where they have livestock diseases. So now we have the Ministry of the Environment also, so we have 3 government agencies and local people all joining forces to work around a common good. So we found some common ground, so it's a win-win in this case. There's a 4-win situation, and it's very hard to argue with health. We think it's the best flag we could ever fly for the environment and for diplomacy is because who's going to say health is bad? So it's a really great way to get people in the room and agree on things. Congo, probably the seed of many of the kinds of emerging diseases we hear about and are scared about. A lot of it's, of course, linked to the consumption of wildlife and direct contact with diseases. So about 1 billion kilos a year, 1 billion kilograms per year of wildlife is consumed in the Congo. That's the bushmeat trade, and that's a gorilla on the right. Well, why do we care? Well, we should care for a lot of reasons. One is it's devastating wildlife populations, of course, but it's not good for us either. I'll back up a little. These are hunters. They're just going out and trying to get food. You can't really blame them. They need to eat. So we have to work with people and train them about what they can do. So it's a mandrill that's been shot. There's a variety of viruses that are found in primates that get into humans. HIV/AIDS is just one of them. So you think about HIV/AIDS coming from primates originally into humans in Africa and then spreading all around the world, a kind of a global epidemic. And so if you hear someone say that there's no link between wildlife and animals and human health, just say HIV/AIDS. And if they can't figure out the fact that this world has been devastated by this disease, and it all became from human behavior of eating primates because they didn't know any better. So we really have to do a good job to prevent these diseases in the future. We're working in Congo with gorillas and Ebola. It's been a big program of ours for quite a few years. We're probably the only people that have been consistently dealing with this problem for over a decade and taking the risk, and people die from it, even our own staff working on this issue. But it doesn't dissuade us because we're really committed to conservation and making people and animals healthier. So we do it through basically our strategies, which have never changed for 20 years. We don't have to follow the wind or the tides of funding. We just keep doing the same things. It's building local capacity, teaching people how to train to take care of their animals. In this case, how to monitor the health of wildlife, how to monitor the health of people. Really examining animals, how to go through there and test them and see if they have diseases. We've got some new non-invasive techniques that we're developing with National Institute of Health to figure out, are these animals been exposed to Ebola? Can we vaccinate them? Which animals should be vaccinated? Which people should be vaccinated? Some really good questions. How to respond in an outbreak safely without dying. So train local people to respond and make a diagnosis, collect samples properly, connect them with a good laboratory that can make a diagnosis, build infrastructure in Central Africa so they can diagnose their diseases. Public education and outreach, teach people about washing their hands, cooking their food, not eating great apes, not eating primates, being careful, not getting diseases. We haven't had an Ebola outbreak in the Congo now for over 2 years since we've been working with villagers and teaching them about outbreaks. In fact, the hunters now come back and report dead animals to us, and then the Congolese park guards go out and our staff and sample the animals. So it really turned around a situation that used to be horrible Ebola outbreaks into an early warning system. In fact, it's been adopted by the World Health Organization as an early warning system. So we find animals die a month or two before there's human outbreaks. And because of our education and network of contacts throughout the forest into the villages, the people are alerted that there's an Ebola outbreak going on in the forest, and to warn people to be very careful and don't handle dead animals, don't handle sick animals. And it's really had an amazing impact, at least in this part of the Congo. Why should we care? Because now you can travel anywhere in the world in about 24 hours. And now we have about 6, 7, close to 8 billion people on the planet. So 100 years ago, didn't have to worry so much. In the 1800s, it took, a month or two for somebody to travel around the world in a ship. And even then, they brought smallpox to the New World, maybe intentionally. But nowadays, you can get on an airplane and go anywhere. We have millions of people traveling. We have millions of animals traveling around the world. We really are globalized. So any disease in any country can be in any other country the next day. And so why should we care about what's going on in Africa? Because we care about Africa. And some people who don't should care because the following day that disease can be in their country too. Economics, this is why big corporations care. These diseases are devastating. SARS is estimated to cost the global economy about $50 billion. Not very many people died. Not many people died of SARS, but the impact globally on economics was devastating. So more and more of these diseases are really impacting business and how they operate. And so they've jumped in, the private sector has really gotten engaged in this world of looking at where these diseases are coming from and what can we do, what can they do to contribute to keep their markets running. This is one great example. We have a program we call One World, One Health. And this is a coalition of government agencies and private sector coming together to look at the fact that we are just on one world, and that the old division, the segmentation of public health, human health, livestock health, wildlife health was just artificial. That's a product of our university training, because we go to a school, and it's a vet school or a medical school, and we're taught to behave that way, and we've mounted our national institutions have grown up that way. So we have the USDA takes care of the health of animals, and Health and Human Services takes care of people, and that's because of the way we were trained, so we're stuck in that mindset. But there's only one health, and that's our human way of dividing it up is really not serving the world so well anymore with emerging diseases. Private industry has caught this, so you'll see up here Cargill and Pfizer, SAFE is a whole group of food corporations that have come together. ABEF is the Brazilian Poultry Export Association. So like right here, what we see in this room is people coming together because they have common ground and they want to work together. This has resulted in a small grants program for health in Brazil that's close to $1 million to fund small projects in Brazil that link human health and livestock health and wildlife health.